Public health is defined, sorry, public health is defined as the science and art of the three P's that I want you to remember: preventing illness, protecting health, protecting life, and prolonging life. Prevention, protecting, prolonging. Okay? And they do this protecting, prolonging, and preventing um, by improving the nation's health and well-being and reducing health inequalities. So there are over 15 centres across England, each of which provides leadership and support across the three domains of public health, which is health protection, health improvement, and the healthcare of the public. So Public Health England does quite a lot. So they make the public healthier. They do this by reducing health inequality through health promotion, local government action, and enacting public health policies. Public Health England protects the nation from public health hazards. They prepare for and are responsible for health emergencies such as COVID-19. Public Health England improves the health of the nation by sharing information and expertise. Okay, so things like the research that's going into the current coronavirus pandemic, things like putting out information on how to wash, how to prevent, how to take care of yourself, and safeguarding in the workplace. That is all responsibility of Public Health England. Public Health England also supports local authorities and the NHS to plan and provide health and social care services such as immunisation and screening. So if you remember, was it unit 4 or unit 5? No, it was unit 5. We were discussing health promotion. So things like Stoptober, things like Change for Life, things like Be Clear on Cancer. That is all Public Health England providing local authorities with all the information that they need in order to protect life, in order to prolong life expectancy. And a lot of research, clinical trials, that is all Public Health England as well. Okay, another player in the structure of the NHS is the Clinical Commissioning Group. So England's 211, yes, but now 191 clinical commissioning groups are taking over from Primary Care Trust. So if you remember, the Primary Care Trust was a group that was created by the Blair administration in 1997. Clinical commissioning groups took over when the Primary Care Trust was shut down in 2012, and they are responsible for about 80% of the NHS commissioning budget. So they plan and commission hospital care and community and mental health service. So all GP practices have to be members of a CCG, and every CCG board must include at least one hospital, doctor, a nurse, and a member of the public. So the idea of having clinical commissioning groups is saying, okay, we want clinicians to be responsible for the commissioning of healthcare services. So previously it was the Secretary of State, so it was politicians in charge of where the money goes. But the whole point of the 2012 restructure was we're going to take the responsibility of that from the state, and we're going to give it to clinicians. We're going to give it to people who actually know where the money should go to. So this is why we have at least one doctor and one nurse and a member of the public to be part of a CCG board. So they work with local and national health watches. So health watches are responsible for going into the community and saying, what are the needs within this community? Um, they go into NHS trusts, so they go into hospitals and they find out what is lacking. And so national and local health watchers then work with CCGs to say, okay, out of the amount that we have for budget for this year, where should the money go to? And then, of course, we have our primary healthcare services. So we have our hospitals, mental health services, walk-in centres, our community centres. They all receive funding from their local CCG. We also have our dentists, opticians, and pharmacists, and specialist services. We also have complementary medicine, which is stuff like acupuncture, Reiki. It's not always and not necessarily funded by the NHS, but they are ways that we can receive healthcare services in the UK. And patients and public, this is you. Okay, so most healthcare services in the UK is free because the NHS is hugely funded through the taxpayers. So activity, I want you to describe this new structure in your own words, and can you give a purpose for each of the sectors? So what is the purpose of the Department of Health? What is the purpose of the NHS England? What is the purpose of Public Health England and CCGs and primary care healthcare services? Okay, right, so we're going to discuss this further when we go on to Teams in a couple minutes. So if you've got any questions, please write them down and we will discuss.